Bernie. Bernie Sanders says healthcare for all will require a tax increase. Oh, really, Bernie? You're going to tax people more. Interesting, isn't it? Independent Vermont Senator Bernie Sanders admitted Tuesday that healthcare for all will mean more taxes for most. I thought we were only going to tax the rich, Bernie. Wasn't that the case? We have to choose. We have chose not to do. What we have chose not to do, is to tell you how I'm going to raise every nickel in a $3.5 trillion budget. The Democrat president said in his answer questions at Town Hall, Manchester, New Hampshire. That's something that's going to have to be discussed. So I want to lay out the program is what I would mean and to tell you what it will cost you, the ordinary Americans, a lot less than you're currently spending on healthcare on average. Sanders guessed that the money to pay for the universal Medicare would probably end up looking like a payroll tax on employers and increasing the income taxes in a progressive way. Which means exactly what? Exactly? That Senator insisted would result in a significant deductible for ordinary people. Is a low income will pay nothing for it, while upper income people will pay more. Sanders told the crowd, admittedly, this is a complex issue. We have been wrestling with it for years. The self-described Democrat socialists and many Democrats are advocating for Medicare for all. Sanders has said that he partly admires the universal healthcare system for Canada because it's so inventive. Sanders did not talk about the well-known problems with Canadian Medicare, such as extremely late wait times for a variety of operations, from the simplest of the complex. The recent release data from the Fraser Institute revealing that 63,000 Canadians left the country in 2017 to seek medical treatment that they could not obtain or in a timely manner with their own country. The majority of them reportedly went to the US for surgery or other operations. The conservative think tank also reported that the average Canadian family spends more than $12,000 in taxes on government-funded healthcare. Look, at the end of the day, we do have universal income. Universal healthcare here in Australia, which is very similar. We do also have a private system as well. So if you don't want to go with the public system, you can go with private. It does work for the most part. Yes, there are delays on the public system, but it is free. What do you expect? That said, I can walk into a doctor's tomorrow and get a doctor's appointment free of charge. One of my family members has had cancer. He's fine now, don't worry. And he went through the private system because he would have been waiting for ages for the public system. And they were able to get it before it transferred or progressed or whatever it may be. So at the end of the day, there is the both systems here in Australia, and it does work. It does work well. If you've got the money, you can go through. You can go to the private system when, for example, like cancer treatments or whatever it may be, and it generally will be a better option. That said, if you don't have the money, you can go through the public system, and it does work per se, but at the end of the day, I do like the Medicare for all sort of healthcare for all sort of option, but just keep in mind that it is a public system, and the thing is that, for example, the left wing, once they got Medicare for all or healthcare for all, they then wanted to currently keep bumping it up to absorbent amounts. Like one of the election campaigns in Australia here when we had the election a couple of weeks ago was, the Conservative government went through and slashed all the money from the healthcare system. They took $300 million or whatever off the healthcare system. Yes, because they're trying to get the budget in the surplus. And guess what? The healthcare system is a big part of that budget. So even if you get your healthcare for all, Democrats are never going to be happy with it. They always want more and more money. And like Eric says, of course there'll be higher taxes. Not surprised. No, no one is. And I think they're just being intellectually dishonest when they turn around and say it. The fact is that if everybody goes through and pays their taxes, pays extra in taxes, yeah, you can have your universal health universal healthcare for all, whatever you want to call it, healthcare for all, whatever. Yeah, you will have it, but you will pay extra in taxes. The average tax rate in Australia is around 37%. It's a bit different than America. And we have GST on top of that as well. So not only are we paying around 30% with our taxes, 33 I think it is, it's also 10% as well for GST. So that's how we pay for our Medicare for all. Is we all pay for it, whether you use it or not. So yeah, I don't know. Let me know what you guys think in the comment section below. What are your thoughts on healthcare for all? Do you think it's a good thing? Do you think it's a bad thing? Let me know why. Let me know those thoughts in that comment section below.